Hi, everyone. I'm just going to begin today with a small access note. So there are several ways in which you can access today's talk. There's going to be a live transcript at the bottom. You can see a CC button. And if you'd like, you can click that and you'll be able to see the live captioning that we have. We also have ASL interpretation. And if you'd like to use that, make sure to pin their videos so you can see them at all times. Additionally, because it is more difficult for folks to see interpretation if there are multiple videos on screen at once, we ask that unless you're speaking, to not put your video on. And I think we're going to wait to enable everyone to use their microphones until after the talk and during Q&A period. Okay, and now I'm going to pass this off to Esther.
Okay, thank you, Tali. So my name's Esther Ignani, and I'm the director of the School of Disability Studies. My pronouns are she, her. And I want to open today with a land acknowledgement. So at the School of Disability Studies at X University, we open our talks with a land acknowledgement as a way to acknowledge that this university and our school is located in territory, located on territory and on land that was taken from Indigenous people and controlled by colonizers. So Toronto and the School of Disability Studies is located in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, the Mississauga, and the Haudenosaunee that bound them together to share the territory and to protect the land. Subsequent Indigenous nations and peoples, Europeans and newcomers who were either brought here by force or came here by choice, have been invited into this treaty in the spirit of friendship, respect, and peace. Given the events of the past couple of weeks, our colleague, Dr. Lynn Lavallee's comment around land acknowledgements comes to mind. Dr. Lavallee refers to land acknowledgements as a form of truth-telling. And at this moment, I, as a white first-generation settler, can think about the truth of being part of an education system from which I benefit, but that has been a tool in the ongoing colonization of Indigenous people and their cultural genocide. It's beholden on us to read and enact the 92 recommendations from the Truth and Reconciliation Commission report, and to try to transform what the education system is into something where we unlearn previous ways of doing. I think today's talk and this course, which hosts the talk, is one step in doing that work. I turn things now to Dr. Jacqueline Getfield, a new instructor in the School of Disability Studies, was graciously agreed to lead the Transnational Bodies course. Dr. Getfield.
Recording in progress.
I thank you very much, Esther. My computer has decided to catch whatever your computer has, and so the video just wouldn't. I just couldn't get the video working. I thank you. I thank the students of DST 604 for showing up in such large numbers. This is a very important section module. And so I will just get started with the introduction of Dr. Annicia Gayle-Geddes. Dr. Annicia Gayle-Geddes is Adjunct Professor in Disability Studies at Ryerson University and Adjunct Professor in Critical Disability Studies at York University in Canada. She is a social policy development, monitoring, and evaluation professional whose work has spanned the Caribbean and South America for over 18 years. This work included strengthening the participation of marginalized groups in socioeconomic projects, including indigenous peoples, youth, children, women, girls, and persons with disabilities. She has worked at the Caribbean Development Bank and has been research consultant with international organizations such as World Bank, United Nations Development Program, and the United Nations Educational, Scientific, Cultural Organization, UNESCO. She currently works at WhatsApp. Annicia is a Global South scholar in disability and development in English speaking Caribbean with published papers, book chapters on the subject. She is the author of the seminal book, Disability and Inequality, Socioeconomic Imperatives and Public Policy in Jamaica. This book was published by Palgrave Macmillan, and she's the contributing author for UNESCO's inaugural 2020 Regional Report on Inclusion and Education in Latin America and the Caribbean. Dr. Gayle-Geddes is a tireless disability advocate and has served as a member of the Jamaica Society for the Blind Scholarship Committee. She has been a member of Jamaica's National Disability Advisory Board, member of the Legislation Committee for a Disability Act, and chairperson of the National Consultation Committee for a National Disability Act, which became law in Jamaica in 2014. She is also founder of the Marlon King Scholarship Fund, which supports the education of secondary and tertiary students with disabilities in Jamaica. Annicia recognizes the need for rigorous academic scholarship to inform evidence-based public policies and programs. She therefore provides the practical perspectives of developing countries into the discourse of disability and development in the Global South. Her research interests include critical disability studies, social protection, education and technology, employment, participatory community development, citizen security, and gender and intersectionality analysis. We welcome Dr. Annicia Gayle-Geddes.
Thank you so much, Esther and Jackie, for your warm welcome. And it is really a pleasure to be here with you today. So today's topic is entitled Disability and Inequality in the Global South. And we will be talking about this topic, taking the lens of the Global South narrative to the English-speaking Caribbean in particular. So I'm being aided with the slides today as having some challenges with converting from Keynote to PowerPoint. So Tally is assisting me with that. So I thank you, Tally. So we'll go on to the next slide, please. But before we begin to discuss the topic in earnest, I wanted to share a little bit about me and my own intersectional self-location, because you might wonder why I am qualified in any way to speak on this topic. And I do view myself as a lifelong learner. So here's a little bit about me. I'm from Jamaica, the post-colonial Caribbean. The Caribbean was subject to the transatlantic slave trade and was made subject primarily of absentee colonization and slavery, which is quite different from settler colonialism, which would have been experienced in North America, for example. So many scholars argue that absentee colonialism in the Caribbean was certainly more brutal than it was in settler colonies. I am an immigrant to Canada as a permanent resident there. I'm classified as a racialized minority, and subject to various gender stereotype and socioeconomic doubts because of my academic qualifications. I am a disability advocate, as Jackie would have alluded to. I'm also the mother of a child with a disability. And so a lot of my background would have gone into much of the research work that I would have done. And I have selected two here to display on the screen today, one of which is Disability and Inequality, Socioeconomic Imperatives and Public Policy in Jamaica, as well as Occupying Disability, having a contributing chapter on social policy issues affecting persons with disabilities in Jamaica and the Republic of Trinidad and Tobago. So that is the backdrop. So I can certainly feel and empathize and intentionally align with our Indigenous colleagues at the university in the call for justice with respect to all that is happening in the Canadian context currently. So we'll go to the next slide, please. So all of that to say that this is the background to how we got here today. And in the context of the English-speaking Caribbean, there's a great paucity of data. And so I have a quote here from a person with a disability who says, "We start off not really knowing." And the lack of knowing we see in the academy of the global north, where discourse on the global south is largely absent. And I reflect on Chris Bell's paper on the fact that a question was asked, is disability studies white disability studies? And so I hope from this discussion today to add some color to the context of critical disability studies in the Canadian context. So in the Caribbean, there's an ongoing post-colonial decolonization agenda, which has in its backdrop the transnational capitalism processes, which are still at work today. And so that post-coloniality context is riddled by Afro and African and Indian diasporas in the Caribbean context, and of course, other Asian immigrants. So the systemic neocolonial oppression has contributed to what is considered the paucity of data on persons with disabilities from the English-speaking Caribbean. So my work and research has really focused on what I call the materiality of inequality and the materiality of inequity, with keen focus on education and the labor market, as well as the socio-cultural context in which education and labor market inequality and inequity are interwoven inextricably. So it's important for us to reflect on the fact that intersectionality binds the experiences of persons with disabilities globally, and the global south is no different. Next slide, please. Next slide. This is a slide that was riddled by confusion, but the previous slide attempted to show the movement of people from the African continent to the New World, as it was called, in North America, Europe, as well as the English-speaking Caribbean. So when we reflect on the global south in particular, there are two quotes that I draw on here from Erveles as well as Mikosha and Sadaltik. Mikosha says the fact that imperialism and colonialism stand as root causes of massive violations of human rights, famines, malnutrition, and ecological degradation of indigenous land, and as the root cause of growing impairment in the global south. Erveles contributes to this argument of looking at the unique idiosyncrasies of disability in the global south by saying that disability is not a condition of being, it is a condition of becoming. So with the architecture of colonialism, we see that disability was reproduced and produced by factors of violence and exploitation in terms of the control of people and the behavior on plantation ecologies in the English-speaking Caribbean. Next slide, please. Such practices resulted in the amputation and maiming of physical bodies and the harming of such bodies. And so when we take a look at the Global South scholarship, there's an attempt from the Global South to disclaim the whole matter of the universality of disability. In the Global South experience, in particular in the Caribbean, we see that disability is not, in fact, normative in many respects. It was created by plantocracy from the absentee landlords presiding over slave bodies and dismembering such bodies as punishment for failing to deliver on quota of sugarcane, of working at the sugar mill, or various other responsibilities on the plantation. And so Global South scholarship brings central attention to the creation of disability by violence and redirecting the discourse from the metropole and the focus on the shaming of prevention of disablement in the Global North scholarship as being part and parcel of the experience of disability in the Global South. So what we find in the Caribbean context is that there's not an artificial separation of impairment and disability because of the history of violent creation of disability. There's a wedding, there's a marrying of impairment and disability, which is very much different from the traditional social model of disability that emerged in the Global North that tended to give a greater focus on separating the impairment from the disability, which is constructed by inaccessible environmental factors as well as attitudinal context. So the gestures of exclusion of the Global North for disability scholarship in the South is given greater emphasis by disability scholars in the Global South, such as myself. Next slide, please. And so today I want us to focus on what are those material inequalities and inequities that we can learn from the English-speaking Caribbean. So in terms of the global context, the United Nations has what is called the Sustainable Development Goals, which replaced the Millennium Development Goals. The Sustainable Development Goals are 17 in total. And for the first time, they have disability disaggregated targets which are set. For the Caribbean community in particular, the countries that are a part of the Caribbean, some are member states and associate member states have what is called a Pétionville Declaration, which called for the development of legislation in English-speaking Caribbean countries. And as a result, 11 countries of the Caribbean, such as Antigua and Barbuda, Jamaica, Trinidad and Tobago, and so on, are signatories to the Convention on the Rights of Persons with Disabilities, and 2 countries have accession. With respect to legislation in the Caribbean, 5 countries have legislation, and they include Guyana, Barbados, Jamaica, the Cayman Islands, and Antigua and Barbuda. And similarly, 4 of such countries have disability policies: Guyana, Jamaica, Trinidad and Tobago, and the Cayman Islands. Next slide, please. But what we have found is that the presence of policy does not dictate the equal conditions that are experienced by persons with disabilities in the English-speaking Caribbean. And so the data that we have available from the UNICEF, United Nations Children's Fund Multiple Indicator Cluster Survey, shows that the prevalence of childhood disability exceeds the world estimates of prevalence of disability. That is, with respect to the global population, some 15.3% of the population is estimated to have disabilities. Comparatively, most mixed studies, multiple indicator cluster survey, shows that disability ranges from 8% in Barbados to a high of 24% in Suriname, which was formerly Dutch, and 24% in Jamaica. Next slide, please. And of course, the characteristics of disabilities vary by type of impairment as well as severity of disability. And so we find that, using Jamaica and Trinidad and Tobago as examples, that the disability types that are more visible are the ones that tend to get reported in censuses, such as visual disability, physical disability, and hearing disability, and less so those that are invisible, such as those that we define in the region called behavioral, intellectual, or learning disabilities. Next slide, please. We also find that a majority of persons with disabilities have what are considered mild or moderate disabilities. Only about 1/3 have severe disabilities, and these are categorizations that are self-reported. Next slide, please. So what do we find from the sociocultural context in the Caribbean? I have 2 quotes here from qualitative work that would have been done. One person with disability says, in the Caribbean, society is designed for the accommodation of people without what we call disability. And there are more difficulties to overcome for persons with disability. Another says, a considerable number of persons with disabilities are not coping. Functioning with a disability is like functioning as a left-hander in our present right-handed society. And so the sociocultural context of the Caribbean is one in which persons with disabilities do not feel a part of the mainstream of society. They consider themselves on the periphery, on the margins of existence and acceptance of identity. Next slide, please. When we take a look at the data that is available to assessing education and labor market in particular, we start with education. And so when we take a look at Guyana, we find that 42%, this is the Republic, the Cooperative Republic of Guyana, previous British colony, the Republic of Guyana data shows that 42% of persons with disabilities under 16 years of age never attended school at all. And this is from research that was done by the National Commission on Disability. When we take a look at research that would have been assessed by the Economic Commission for Latin America and the Caribbean, we find that 18% of children with disabilities 5 to 14 years of age, were not being educated at all, compared to 4% of children without disabilities. So you're talking about 18% of children with disabilities do not have access to school, compared with a lower proportion of 4% of children without disabilities being out of school. With respect to likelihood assessment, a higher level regression analysis, we see that in Grenada, for example, children with disabilities were 16 times more likely to be out of school compared with children without disabilities. So for every one child with without a disability that is out of school, we have 16 more children with disabilities who are outside of school. And when we take a look at the data for children for Trinidad and Tobago, we see that children with disabilities were 7 times more likely to be denied access to education compared with children without disabilities in Trinidad and Tobago. Next slide, please. When we take a look at the data that I would have contributed to the UNESCO's Global Education Monitoring Report, its inaugural Latin America and the Caribbean report, when I took a look at the data from the 2011 census, we see that children 5 to 17 years of age, and this was done in 2020, 27% of children without disabilities were not enrolled in school, compared with 5% of children without disabilities. And of course, a slightly greater percentage of males were out of school compared with, or not enrolled in school compared with females. That is 30% of males, children with disabilities who are male, who identify as male, and 24% of children with disabilities who identify as female. And of course, these data sets are constructed in binary terms of male and females. When we took a look at the data from the census for last school attended, we see that 53% of children with disabilities were at the lower level, completing lower levels of education at the primary level, compared with 3% of children without disabilities. So we're seeing from the data that there are clear inequalities between children with disabilities compared with children without disabilities. Next slide, please. So what do we find from the qualitative data that supports these findings from the quantitative data set? A person with a disability says, for them, social mobility is impossible without education. And another caregiver of persons with disabilities says, so long as they don't have any barricades or barriers, no one to let them feel they can't achieve, they function just as well as persons without disabilities. Next slide, please. And so my interest in specifically looking at education and labor market issues came out of qualitative work that I did, and I consulted with persons with disabilities and found out, using what I call an emancipatory report approach to conducting research, what are the key issues that you want to understand as a tool for better advocacy. And consistently, the participants have always identified, we want data on education, on training, on labor market, and participation in society in general. And so that is why most of my research has been targeted to focus on these specific areas. So we've talked about comparing the data for children with disabilities so far compared with children without disabilities. But what does the data show for persons of the working age? And so I have some data here to share with you with respect to education and training for the working age population 15 to 64 for Jamaica and Trinidad and Tobago. So when we take a look at this first line from this table that I've constructed here, we will see that for Trinidad and Tobago, only 1% of persons or working age population did not have access to any form of education and training at all. When we took a look at working age population of persons with disabilities in Trinidad and Tobago, we saw that this comparatively was 10.5%. So we're seeing that 10 times the proportion of persons with disabilities were less likely to have access to any form of education. So the findings with respect to the comparative data is startling, and it is very much linked to the oppression narrative of the fact that, linked with the slave context, that persons with disabilities were seen as less productive on plantation societies and were set to infirmaries and institutionalization. And as a result of that, the exclusion narrative has been passed down throughout generations. When we look at the data for Jamaica in particular, it's less skewed in that 0.3% of persons with disabilities, let me rephrase that, 0.3% of persons without disabilities were without access to education compared with 5% of persons with disabilities. So in the case of Trinidad and Tobago, 10 times persons with disabilities of the working age were 10 times more likely to be without access to education. And in Jamaica, persons with disabilities of the working age were 5 times more likely to be without access to education. And of course, this is a simple presentation of the information looking at last school attended. The access to level of education also translated to information, to certification achieved. So when we looked at the certification data, we saw that persons with disabilities were less likely to have certifications in Caribbean Examination Council. Those are the exams at the secondary level, and a greater proportion of persons without disabilities were accessing tertiary education. Next slide, please. Let's take a look at employment. When we reflect on Guyana, for example, the survey that was done by the National Commission on Disability, we found that 17% of persons with disabilities over 18 years of age were employed. Only 17%. Okay, so that means that 83% of persons with disabilities in Guyana were out of employment, and 40% of them face job losses with the onset of disability. The data that is compared for Antigua and Barbuda, the Bahamas, Barbados, Grenada, Netherlands, Antilles, St. Lucia, St. Vincent and the Grenadines, and Trinidad and Tobago shows that only 34% of working age persons with disabilities were employed, compared with 59% of persons without disabilities for the aggregated employment data across these 8 countries. Next slide, please. When we examine the data in terms of labor market for Jamaica and Trinidad and Tobago, we see some interesting things disaggregated by sex here. So for example, when we examine the labor force participation rate consistently for both Trinidad and Tobago and Jamaica, we see a higher labor force participation among persons without disabilities compared with persons with disabilities. We also see higher employment rates among persons without disabilities compared with persons with disabilities. So for example, for those participating in the labor force for Trinidad and Tobago, 62% of persons without disabilities were labor force participants compared with 31% of persons with disabilities. So half the proportion of persons with disabilities were participating in the labor force, meaning they were either working or seeking employment. And so the high exclusion from the labor market has led to a low job seeking rate among persons with disabilities. And this characteristic is also consistent across sex. So we find that for males, a higher proportion of them were participating in the labor market compared to females, for both persons without disabilities as well as for persons with disabilities. So when we take the intersectional lens, we see that not only disabilities are a contributor to status in the labor market, but also sex. So I'll give you two examples here, where labor force participation rate for males without disabilities in Trinidad and Tobago stood at 78%, while males with disabilities, only 38% of them were participating in the labor market. And it's even more startling when you look at employment. 73% of males without disabilities were employed, compared with 35% of males with disabilities. When we take a look at the disaggregation by sex further, we see, for example, in Trinidad and Tobago, 38% of males with disabilities were participating in the labor market, compared with 24% of females with disabilities. Okay, so that information, that data is also replicated, although with a different proportions in Jamaica. So for example, we see for Jamaica, 85% of males without disabilities were labor force participants, compared with 65% of females with, sorry, let me repeat that. 85% of males without disabilities were participating in the labor market, compared with 65% of males with disabilities and 49% of females with disabilities. So it's interesting to see that the inequalities here cuts across labor force participation rate, employment rate, unemployment rate, job seeking rate, and absence from the labor market. Next slide, please. When we have a look at occupation and income, there are certain correlations that are established, and we see that a higher proportion of persons with disabilities are in what we call elementary occupations, that is janitorial, cleaning services, that are not necessarily the desired blue, white collar professional ranks. Okay, so we see the disparities by occupation as well. Next slide, please. We also see the disparity when we look at income. And so at the lower bar of income earned in Trinidad and Tobago, for example, which is less than $500, and for comparative analysis, it's approximately $6 Trinidad and Tobago dollars to $1 US. And we're seeing that a higher proportion of persons with disabilities were earning in the lowest income category. 47% of persons without disabilities were earning less than 500 TT dollars, compared with 58% of persons with disabilities. Next slide, please. The income disparity was also evident in Jamaica, where the lowest income categorization, we saw that 14.4% of persons with disabilities were earning in that category, compared with 8% of persons without disabilities. Next slide, please. What this data shows us too is that there's a correlation for Jamaica with respect to the lowest income category, where twice the proportion of persons with disabilities were earning below the minimum wage. So as a public policy measure, the government of Jamaica has what it calls a minimum wage threshold. But even within that threshold, we see that twice the proportion of persons with disabilities were earning below the minimum wage. And so I recall speaking with a mother with a disability who explained that for her, working below the minimum wage was not an option, even though there was a public policy imperative against it, because she would risk losing that earning below the minimum wage and not being able to take care of her child as a single parent. And so that was referred to as bread and butter issues. And she was unlikely at the time to report that employer, because the employer, as it were, came to an agreement for that kind of income, which in the words of that mother was better than nothing and was necessary for survival. So the next two slides I have here is a simple graph, again, showing labor force participation being higher for persons without disabilities compared to persons with disabilities, using Jamaica as a case here, where we're seeing, for example, that in 1991, 61% of persons without disabilities were participants in the labor market, compared with 38% of persons without disabilities. And then in 2001, for example, 75% of persons without disabilities were participating in the labor market, compared with 57% of persons with disabilities. Next slide, please. And then we also see the similar data here for employment rates, where we have a higher percentage of persons without disabilities being employed. That is 52% of persons without disabilities, compared with 34% of persons with disabilities in 1991, and 64% compared with 49% in 2001. Next slide, please. So what do persons with disabilities, and I have here the quote from a caregiver, say about labor market issues? A person with a disability says, not because he has, speaking in the third person here, not because he has a disability means he cannot do it. That's depriving him of doing something, in this case, working. Another caregiver here says they can. People with disabilities can work if they're given the opportunity and function just as well as anybody else. And another person with a disability is here saying disabled people are suffering, where minimum wage is set, but they are working for less than that. And I've brought here in the Jamaican Creole, or Patois, which is a combination of the African-derived languages and the English language. Next slide, please. So what do we see with respect to disability and intersectionality in education? One finding we can reflect on is the fact that adults or working age population, those that attended mainstream schools only, tended to have higher levels of certification compared with working age persons with disabilities that went to special education schools mostly. And so in the Caribbean, we have this emphasis on separate, segregated, apartheid education systems for persons with disabilities. And so the majority of persons with diagnosed disabilities tend to find themselves in special education schools. And the data is showing that they are having poorer or weaker educational outcomes compared with the working age population that attend either mainstream schools only or attend mainstream as well as special education schools, a combination. So the data is showing here that special education schools only do not necessarily, have the outcomes that have been touted since post-colonial times, okay? When we look at type of impairment, we see that working age population with visual and physical disabilities attained higher levels of education and certification compared with other types of disabilities. And there are perhaps several reasons for this, in that the invisible disabilities, the intellectual disabilities, the learning disabilities, like the dyslexia and so on, tend to be sidelined, meaning that if the persons with visible, non-visible or invisible disabilities are present in mainstream schools, they tend to go undiagnosed in the Caribbean and tend to be left behind in the classrooms. So the persons with the visual and physical disabilities have been playing a more activist role in terms of advocacy, self-advocacy, and agency, demanding changes and accommodations. And we see this uptick in terms of the higher education and certification outcomes among the visual and the physically disabled persons. And likewise, for them who are asking for accommodations and individualized education plans in the context of the Caribbean, they tend to be the persons with the more severe or moderate impairments versus the mild, who tends to get left behind in mainstream school. Next slide, please. So with that said, again, disability and intersectionality, when we look at education, again, we're seeing that more females, a greater proportion of females completed tertiary education and had certification, tertiary certification compared with males. And so this is consistent with the general trajectory of the Caribbean in the context that females in general tend to attain higher levels of education in the Caribbean compared with males. And so, for example, there's some scholarship that was done by Barry Shevans that is called Tie the Heifer, Loose the Bull, where the girls were given the domesticated work inside and were trained more likely to read. And a lot of the schools that came in the post-colonial societies were set up, and they were all boys school in some instances, or all girls schools, and the girls were given greater attention, while the boys, in terms of tie the heifer, loose the bull, were expected to do the yard work and the outdoor work. And so we find that girls are more domesticated, and there's a higher level of expectation for their success in education. And when we look at the data across the Caribbean, we're seeing that at the grade 9 level, the exit proportion, the number of males that are leaving the education system, that proportion is significantly higher compared with girls in the education system, both with disabilities and without disabilities. Intersectionality, again, is very evident when we look at the data in terms of education and certification by urban versus rural areas. So persons with disabilities in urban areas had higher levels, completed higher levels of schooling and attained higher levels of certification compared with rural areas, or persons living in rural areas. And when we looked at the data and disaggregated it by age cohort, we see that the older cohorts had reduced access to education and certification. So the younger you are, the higher likelihood for number of years to complete, number of years of schooling and higher levels of certification. So this is a positive in that the over time, when we look at the comparative analysis of various data sets, we are seeing that a great increased proportion of persons with disabilities, particularly the younger age cohorts, are attaining or more involved in accessing education and attaining certification. Next slide, please. So with that said, it's important for us to, again, I believe one of the earliest slides I would have alluded to the fact that persons with disabilities represent a heterogeneous community, and in many times there's a homogenization of persons with disabilities in the global south. And I just want to use this slide here to again bring to our attention that when we look at qualitative as well as quantitative data from the global south, we have to realize that there are findings that are different by race, by urban rural location, by gender, by age of the disability onset, by severity of impairment, type of education access, and poverty level of the household. Okay, so when we take a look at age of disability onset, for example, we see that those who attain or acquire disability at a later age, the impact on their education is less significant, and the impact on their employability is less significant because they would have already completed their education and they would have already entered the labor market as a person without a disability. And so the attrition level is less compared with a person who was born with a disability, who have to contend with that across the lifespan. Next slide, please. So I believe this is my penultimate slide, and I just wanted to summarize here what are some of the key determinants for what I call political and socioeconomic inclusion of persons with disabilities in context of what are persons with disabilities asking for in the global South, using the English-speaking Caribbean as a case study. The overarching objectives that are being called for in terms of rights and advocacy and legislation is overall equal rights and opportunities for persons with disabilities, for human capital development and participation in all facets of life. Politically, whether it's in representation politics, whether it's in leadership as in a parent-teachers association, whether it's in a church or a local club or society, they're asking for full participation in all political processes, as well as socioeconomic processes. In particular, these areas that I have identified here for the full gamut of human rights, social protection, and basic social services. So one example of this is in Jamaica, for example, there is a proxy means test that is done for a household to determine if they would qualify for social protection. And so what we have found from the research is that even though a household may be non-poor, when there's a person with a disability in that household, they tend to have less access to the resources. And so when we take a look at advocacy and social protection, the policy environment needs to look at issues of intra-household poverty and how resources available in a household is distributed. And so if you use a means proxy test for the household in particular, you may find that that household does not or may qualify for social protection assistance or poor relief. However, the resources are not necessarily directed to persons with disabilities. And so there is need for targeted support. If it's, for example, subsidies for education for students with disabilities, for example, so it's targeted so that their needs are being met specifically. The third area that I call as a key enabler for human rights progress is that of assessment, rehabilitation, and healthcare. And again, here there's a dissonance between the Global North Scholarship and the Global South. In the Global South, assessment, rehabilitation, and health is given frontal position in advocacy and in research and as part of the literature, because the access to rehabilitation and healthcare is limited, especially, and is not necessarily disaggregated and provided differentially to target persons with disabilities. And so I give you an example of social and reproductive health care, for example. When persons with disabilities in the Caribbean are trying to buy contraceptives, pharmacists may look down on them and give them asexual inferences as if, why do you need to buy a condom? Do persons with disability have sexual intercourse? And that kind of a thing. And so you can imagine what are some of the multiplier impacts if it is that access to contraceptives are limited to persons with disabilities, and what that will mean for their reproduction, and the cyclical antecedent to poverty and the continuing trap of that. The fourth area is the importance of communication and environmental access. And this speaks to, for example, sign language communication for the deaf or for the hearing impaired, environmental access for persons with physical disabilities, the full gamut of accessibility for persons with disabilities. And then the last two areas that I would have alluded to for the majority of the talk today is about equal access to education and training and labor market in terms of employment. And when we speak of these areas, the pressing requests are for reasonable accommodation, targeted support for education and training, for example, for the blind who are faced with challenge with understanding mathematical subjects because of the absence of tactile devices for them to understand what a square looks like, for example, or a rhombus. And so the provision of tactile devices and tools would be important for mathematical subjects for the blind, for example. And what does this mean for employment? For another example is that of job school to work transition support services for students with disabilities. Many graduates, even at the tertiary level, do not have access to employment because of stigma, discrimination, and the attitudinal context, which allows for doubt, oppressive doubt in the eyes of employers. So persons with disabilities, the data shows in the Caribbean that most of them who secure employment, it results from personal contacts rather than the open labor market. So I'll conclude this slide by saying that these 6 enablers in terms of human rights in general, social protection and basic social services, assessment, rehabilitation and healthcare, communication and environmental access, education and training and employment has to be following what is referred to in this slide, a twin track approach to social and institutional provisioning. That is mainstreaming disability in public policy and development initiatives, and then also concurrently on that twin track, providing disability specific policies and initiatives to empower persons with disabilities. Along with this twin track approach is the importance of anti-discrimination legislation so that persons with disabilities can have a stake by law in securing their rights. Next slide, please. So I end here the talk before we go into discussions with a quote from a person with a disability who says, we can do or achieve things just the same as anyone else. And so we need to, in the global scholarship of understanding disability in developing countries, need to understand what are those disability specific needs in the global south and how they differ from the global north, and then giving central focus to that in research in the academy. And so this is really a challenge to my colleagues at the university who may be listening now, to encourage students to expand research to the global south and recognize that over 75% of persons with disabilities actually live in developing countries. And so the extent to which we can cause a shift and create a change globally to improve the lives of persons with disability is in large part hinged on our ability to start researching in the global south in partnering with persons with disabilities. I want to say that over the years, my research has tried to have a board of disability researchers as co-researchers with me. So the latest work that I would have done for UNESCO on the Global Education Monitoring Report, Persons with Disabilities Facilitated Focus Group, Elite Interviews, and so on. So we need to see persons with disabilities as partners in the research and development agenda so that research can truly be emancipatory. So I'll stop here as we reflect on the fact that, in the words of persons with disabilities, nothing about us without us, and we can do the things just the same as anyone else, just perhaps in different ways. Thank you.
Thank you so much, Annicia. Jackie, would you like to go ahead and start questions? Would you prefer that there be questions from the audience first?
I would love if the students, especially the students in DST 604, they had any questions. I'd love to hear those questions myself. And then if there's any time towards the end, I'll ask the questions that I've placed in the chat. I did that so that the ASL interpreters will have an idea of the questions in advance. Yeah, so go ahead with the students first. Thank you.
Okay, well, at this moment then, I know there were some questions already posted in the chat, but if any students would like to unmute themselves, you're welcome to do so. And if there's space, I'll start asking questions from the chat as well. Okay, so we had a question, sorry, I'm just finding it, from Noam that asks, are there any data on disparities within the LGBTQ+ community?
No, we don't have much data on that LGBTQ community. Most of the data that we have in terms of existing secondary data would have been, I believe an earlier slide, I alluded to it with collected data using binary terms of male and female. So that is certainly an area for research. So I encourage the person who asked that question to get involved, if you are not already doing so in that space. But as far as I'm aware, we don't have much data on that at all.
I'm not a student with the Ministry of Social Development in Grenada, and I would have worked with Dr. Geddes in her capacity as the social analyst with CDB, and she has also become a very close advisor and friend, because I just completed and will continue work. My final project was looking at disability and education. So to that question I want to ask, to get to that point of the question I want to ask, is two prongs. From the ministry point of view, we have to work on disability policy, getting a disability policy in place. Unfortunately, because financial resources are limited, we have to seek support from our developmental partners. Now, in one such conversation, because I work within the policy unit at the ministry, and in one such conversation with the developmental partner, they were identifying this is not necessarily, this area of work is not necessarily within their portfolio of program of work. So what I have been advised is that we have to have that conversation where we look at a collaboration of the different partners. So you have the various intersects coming into play, whether it's developmental practice, so UNDP, UNFPA, UN Women, PAHO, we get that kind of intersect going. My question is, based on that suggestion, how can I, from my end, get that conversation going within their halls of communication? And from personal end, I am so thankful that I sat in this webinar today, because you have definitely articulated why I need to go further in terms of disability studies as it relates to education. I need to keep pushing the envelope in terms of getting the education going, because we really do have a paucity of research and there's a lot of work to be done. And the angle that I'm looking at is looking at the voices of students with disabilities. Let's get them into the discussion. Let's all be part of that discussion to push the agenda from their end to get into the global education agenda. Thank you for my little piece, and I look forward to your response.
Thank you. Thank you so much for sharing on that. You know, the whole matter of the participation of disability is always a subject that is not owned well in the Caribbean. And so it is something that most times the buck is being passed on to another ministry or another agency. And in fact, for the most part in the Caribbean, it's ensconced in the health ministry or social development or transformation. What I want to say is that there has to be the brokering of high influencers to kind of move the pendulum for change, because I believe that the whole matter of development partners saying this is not our area of focus is really a significant cop-out, because disability inclusion is everybody's business. If you look at the global statistics of 15.3%, and particularly for the Caribbean, where the demographic profile, it's an aging population. So it means that in the next 20, 25 years, we are having a greater proportion of persons becoming disabled by impairments. The second thing that I want to mention that for the Caribbean too, as a causative agent, is the whole matter of the prevalence of non-communicable diseases like hypertension, diabetes, and so on. And so we have two critical contributors to what's happening. And of course, the third one, in some countries, crime and violence, a major contributor in some countries. And so I would suggest that there has to be the identification of a high influencer to get buy-in, so that disability is treated with as a subject that cuts across. I don't want to say cross-cutting, because usually I find that when we say cross-cutting, it gets cut out very much, kind of like how we treat gender equality in the Caribbean. It gets cut out and left behind. It has to cut across, included, mainstreamed in all processes. Some countries have used the establishment, for example, of an interministerial committee, or the Prime Minister may put in place a special task force or a disability advisory board, where you have some high influencers being a part of the discourse that can drive the agenda. Just recently, I think maybe 3 or so years ago, the Caribbean, the CARICOM, the Caribbean community, which is a conglomerate of the various English-speaking and some associate non-English-speaking countries, have appointed what is called a CARICOM disability rapporteur in the person of Dr. Floyd Morris, who has also been recently appointed by the UN on the committee that's tracking the UN Convention on the Rights of Persons with Disabilities. So as a strategy, I would say that there is need for partnership, whether at the international level and also at the national level, to gain buy-in, high influencers, to move the conversation and the agenda, and for people to see that so-called normal people have concerns with disabilities. Because I use the term normal because in many of our Caribbean countries, while I'm researching, and you might ask for a person with visual impairment, I remember going to a haberdashery, a store, like a wholesale, looking for someone to interview who worked there, and they did not know the term visually impaired. And when I described that the person uses a cane, etc., they said, "Oh, you mean blindy?" And the man's name was not even known. He was just called blindy by his colleagues. And so there are socio-cultural, attitudinal barriers which render persons with disabilities, their identity and acceptance in society as negotiable, even though that is changing in different countries by high-level appointment of former Senator Eiffel in Barbados or Senator Morris in Jamaica, etc. But there's still more work to be done. So that's what I would suggest as a two-pronged strategy, trying to find some partners at the Caribbean level and the international level. And sometimes the UN have acceleration framework for resources that you can call on. I believe the UNDP office in Barbados, you can reach out to the human rights officer there. I believe it was Michelle Brathwaite. Pardon me if I'm forgetting the correct name right now, but there are opportunities to partner to get things going. Thanks.
Thank you. We have quite a few questions in the chat, so I'll try to get to some of them. The next one says, what has been the role of the disability rights movement in the Caribbean in your research?
Yes, so the disability rights movement has been central to any change. So if we look at Jamaica, for example, there are certain provisions that are in place that have resulted exclusively from the advocacy of persons with disabilities, including policy, and this also extends to Trinidad and Tobago, it extends to Guyana, it extends to the Cayman Islands, it extends to the Bahamas. I would say what has been achieved has been a tribute to the advocacy of persons with disability, disability rights advocates, as well as parents with disabilities. So in the 70s in particular, much of the schooling options came out from the advocacy of parents wanting a place for their children, because the English-speaking Caribbean had a copy and paste Education Act, which is the same throughout the region, that says provision of education has a fine like of $1 if kids don't go to school. And then it says something like at the minister's discretion if students with disabilities have access to education. So it's really a colonial blueprint for failure that we have. And so persons with disabilities have been at the forefront of advocating for policy that resulted in the changes in these 4 or 5 countries and the legislation, as well as being at the forefront of advocating for the signing of the Convention on the Rights of Persons with Disabilities. We see that in the Commonwealth of Dominica recently. We see that also in Antigua and Barbuda, the latest country with disability legislation. They have all been as a tribute, a direct result of the advocacy, human rights advocacy of persons with disabilities in the Caribbean. Thanks.
Oh, sorry, we have someone.
Sorry, can I ask a quick question? Just sort of based on, sorry, I'm right in the sun there. Annicia, so just based on what you were saying, I'm wondering if the stigma piece that's been so prevalent in the Caribbean and then Jamaica across the board, mental health, LGBTQ, disability, everything, do you find, as you're saying, in terms of advocacy, that's sort of waning?
I wouldn't say that the advocacy is waning. If anything, it's gathering momentum for more, because persons with disabilities have been increasingly involved in global advocacy for the rights of the Human Rights Convention, for example, like being involved in Disabled People International, the Caribbean, and various other groups. And so, for example, Disabled People International, North America and the Caribbean, I attended an assembly, time flies so fast, that may have been 2019, 2020, and they have a clear agenda for advocating for human rights. So I wouldn't say that the support has waned. What I would say is that there is need for succession planning for younger cohort that take on the mantle from the older cohort. And so this has been something that's been getting attention from disability leaders in the last 5 or 4 years to create the next generation to continue the movement. So the momentum is still there, especially with access to technology. If we compare 2020, 2021 to 10 years ago, the access to the internet and information with what is happening in other countries in the Caribbean and globally is more than 100-fold. And so the expectation of states to deliver on their commitment to the UNCRPD, UN Convention on the Rights of Persons with Disabilities, for them to deliver on the legislations that they have, there is groundswell. However, there's still much more work to be done. Thanks.
Okay. So we have another question from Ava Maria, who asks, how can rehab and health professionals contribute to the empowerment of people with disabilities within the English-speaking Caribbean?
Yes, you know, rehabilitation and health professionals play a critical role. And as I was alluding to the fact that the health as an important part of the disability justice work has been sidelined in Global North Scholarship. That is not the case in developing countries. I was just speaking with a person with a disability yesterday who was reflecting on the fact that he is only able to access physical therapy once per month from the public system. However, because of unaffordability, because he really should be seeing the physiotherapist once per week. And so we see the ability to move functionally using this person as an example. Now, delay recovery, and this is someone who is adjusting to life after a gunshot wound, is delayed. And so the whole matter of care become an extended process, and not just care, we have to overlay that with the correlation with dependence, meaning that the person is outside of the labor market for a longer time and dependent on family members to support and to finance. And sometimes we find that many persons with disabilities, because of the absence of rehabilitation, assessment, diagnosis, tend to lead a life of permanent infancy because of dependence, because they are not able to move beyond and get beyond functional rehabilitation. So this is a critical piece. So in all of the English-speaking Caribbean, there's one rehabilitation center per se, which is the Sir John Golding Rehabilitation Center located in Jamaica. Yes, in hospitals, they have the departments that provide physical therapy services, but other therapeutic supports like occupational therapy, et cetera, is provided at on a limited scale, and they are, where they are available, they are urban centric. And so people in rural areas have a greater likelihood of to be without access. So we are seeing that where the access is already limited, it's urban centric. And even when it's urban centric, you know, there's still a long waiting list. So family member with a learning disability who wants a formal diagnosis to know if it's dyslexia, dysgraphia, dyscalculia, may have to be on a waiting list for 2-3 years before they can get an assessment. And what does that mean for their ability to excel educationally and then transition to the labor market and to lead lives as independent citizens? You know, it becomes truncated at best. Thanks.
Just gonna leave some space in case someone else wants to unmute. But if not, we have more questions.
Hi, Diane Dreger here. I don't have my video going. There I am. Great talk, thank you. I've heard a lot about you from Udallie Wickham from Barnard in Barbados, and I'm happy to meet you through this Zoom meeting. The issues around healthcare in the Caribbean, I find, are becoming more and more similar to issues around healthcare for disabled people in Canada. Our access to good quality primary healthcare and physio and alternative therapies are things that disabled people can't afford here either. And so I have been doing research on that. My colleague, Dr. Nancy Hansen, and I at University of Manitoba. But I'm just saying that in Northern disability studies, we are starting to look at the health. Health is very important. I learned that through living in Jamaica and Trinidad when I was working there in the 80s and 90s. If you don't have your health at a maximum functioning, you're not going to be able to advocate for a quality of life. So it's really important here in Canada too.
Yeah.
Thanks.
Thank you so much for adding that. It's certainly important. Absolutely.
Carmen, do you have your hand up because you'd like to speak next?
Yes, thank you so much. I really appreciate your development of this topic and just showing the context in the situation. I'm thinking of some applications to us here in terms of immigration and settlement. I know one of the concerns that many of the Black community have had includes pigeonholing kids into training schools. And as soon as they arrive, you know, especially the boys, really being a gatekeeper as to which courses they take. And those courses often don't lead them to entry into post-secondary education. And could it be because they have no really great way of assessing the skill and abilities of each student? They just sort of categorize and stereotype and label. So I'm just wondering how we can help that situation here. If you have any advice for us, there may be some children that come up after being estranged from their parents for 10, 12 years. The parents come up first, make a life, and then send for their children. Often they're strangers, and often if there were learning disabilities or cognitive disabilities, it was not picked up, or possibly, even if you can speak to any ways that records, school records, or anything like that might be able to help make better and more individualized assessments. And I'm not even sure if there's enough capacity in the Caribbean for learning specialists and special ed teachers and so on. I'm finding with one young man that I've been following, and he's now 15, that I've only recently realized that he has a significant learning disability, but he's not being followed up at school, and he's taking the same exams with the rest of his classmates.
Yeah, indeed. Thank you for raising that. And yeah, so in the context of immigration and families reunited, I think one of the things that can be done is having assessment questionnaires provided to their last educators. So I have moved, for example, from Jamaica to Barbados to Canada, etc. And I have always, for my daughter in particular, getting the previous educator, being in touch with them and making sure we have the contact information to provide the contextual background information to aid transition. Now, I know not all families will do that, but I think it's a critical point in understanding what needs are. So for example, my daughter in the early childhood level, the teacher observed letter reversal, Z to P9, etc. And so I was able to document that and follow that up. And so in terms of what we can do tactically, that is one thing. Yes, in the Caribbean, we do have special educators who are trained, but the special educators, in my view, are generally trained in a generalist area. So you might have a special educator who is not necessarily a specialist in dyslexia to know, let me try Orton Gillingham, let me try this. The other thing is that special educators in the Caribbean, in some instances, they may have to do a module in special education as part of foundation courses. And so there should be some sensitization to the needs of children. The third thing that I want to mention too is the cultural dimension of disability, because in the context of the Caribbean, sometimes when a person gets a diagnosis, and I'm speaking here now of the relationship between parent-child, the parents will have the refrain, nothing is wrong with my child. So disability is seen as wrong. And so there can be a period of denial, if ever acceptance in some respects, that reduce or causes fatigue or friction with getting the necessary support so that that individual can achieve his or her, or they or them, their full potential, right? So it's important for that kind of cultural context to be understood and extracted from some family members that are supporting that student that would have transitioned to the Canadian context in a non-threatening way, so that one can build trust and work together to provide the supports that they're not left behind. So in the context of Canada, I know that's what a threefold sword of disability, of race, and sometimes the race is correlated with socioeconomics. And so, you might have families doing several jobs, caring for, and the student may not necessarily get the necessary support from parents, but then there are parents who make the sacrifice and are there. And so there's a critical role to be played by school-parent relationships to ensure that the full needs of the students are supported. So those are my three thoughts on what are some of the practical steps that can be employed to addressing addressing some of these loopholes. When we look at, for example, the Jordan Messenger story of, indigenous child with a disability, who pays? Is it the province? Is it federal government? And then in the meantime, people fall through the cracks. But what can we do to correct these cracks is where I pitch my lens as a social policy practitioner at the individual level. What can be done to broker access to address these barriers of inequalities and inequity? Thanks.
Thank you.
Okay, so Jackie, I see that you have your hand raised.
I'm trying to get my video working. Hi, Annicia.
Hi.
I hear you, and I hear Carleen, and I have a question that speaks to stigma, and I'm picking up on Anna's question, one of my students, about stigma. You see, it is one thing for a parent to come armed with a small carry-on suitcase from the Caribbean, from the global South, with papers and testimony of how their children or what their children need in terms of resources. Mm-hmm. But here in Canada, you still have to wait 2 years on the waiting list. So that is a commonality. It is also a problem, and a real problem, I find, within the school system in terms of stigma. So it is not much different from the Caribbean in that there are some teachers, some educators, some administrators who themselves will say, you're not disabled enough, your impairment isn't, bad enough. There are other kids who, and it all is sometimes conflated with race. So who deserves services and who deserves supports? What I'm saying is it is not as clear cut. It is not as, we have the documentation. So yes, indeed, you are eligible for supports and it's gonna be, you're gonna get it right away. Yes. So my question, I didn't really have a question, but now that I'm thinking about it, here's a question for you. What role does stigma play in the Caribbean, where persons may decide not to declare, parents may decide not to declare their children's impairment because they're afraid that of how they will be treated or not treated, how they will be disregarded, how they will be marginalized further? Because disability and impairment and the stigma associated is a real thing, as I said, in Global South and here. So what role does stigma play in that? And if they even declare these impairments, what is the point? Does the Caribbean have the resources to even respond to everybody who does have an impairment and who does need supports and services?
Yes. That is a very good point, Jackie, in terms of even in the global north, there is the whole matter of finite resources. And it's not just Canada, just had some recent experiences in the UK as well, where they have what they call in England in particular, an education and health care plan. And you can in fact wait up to a year or so before, and then the local municipality or borough will say that it's reserved for very severe cases because all schools should have the resources to cater to all students. So that point, resonates with me, which is, it's a global issue really. And it's interwoven with the whole matter again of stigma, because stigma is invisible, yet sufficiently devastating enough to undergird action or inaction. So those recommendations in terms of getting documentation and so on is really not what I'm not communicating is that it simplifies things, but it gives you a tool to document as a script of advocacy, because the work of advocacy is lifelong indeed, if it ever ends, really. I've not seen from research yet where it ends, whether from my experience in the Caribbean, in South America, in Canada, in the US, or in the United Kingdom. That's where my sphere of work would have been. So, or my experience more directly. So it is a continuous work, and stigma is real, and so it impacts, first of all, the psyche of whether you even try to access or think you are good enough, or your child is good enough, or your partner is good enough to access their full rights as an individual. So it can determine the extent to which you participate any at all. And I remember being involved in a debate at a Society for Disability Studies conference some years ago, because the qualitative work that I did included caregivers. And some persons with disability says, nothing without us means us. We do not need the voices of our parents or the voices of spouses. And that's what some people were articulating. But what I have found is that where parents have a child with a disability, for example, they may very well experience that discrimination before the child comes of age, as a child, as an adolescent, as an adult, to experience and even name what discrimination is, because it is unnatural. It's an unnatural construct, as such as race, as such as ethnicities. These are unnatural constructs that seek to serve capitalistic and other interests that we see in society, right? Going back to the sociological primary understandings of a child may be born tabula rasa, and the fact that a child in household A with Russian-speaking parents and Spanish-speaking parents is bilingual, compared with another with 3 different languages is trilingual, and so stigma is really critical, and it's important that we understand it. It's important that we name it, and it's important that we classify it as artificial so that we can dismantle it, disrupt it, so that we can move to action. And sometimes, as people will say, they don't see race, they don't see color. And if we look at Crenshaw's work, that's a part of Kimberly Crenshaw's preoccupation with some of the known scholars now saying, we don't see color, and colorlessness causes the continuation of those inequities along racial lines, because it allows us to continue in the status quo without naming race and its antecedents as a particular issue. And the same thing applies to disability with its unique idiosyncrasies that we need to be aware of. So yes, I certainly agree of the continuity and the similarity in terms of these subjects in different contexts, whether global north or global south. And I do want to underscore, based on what you have said also, that the work of advocacy is the work of a lifetime. It's the work of a lifetime. What I see changing is that the advocates' strength, advocacy is like a muscle, so it strengthens, and you learn from others, and with information sharing and collaboration, you may get better at it, but you always need to be sharpening your tools to do a good job. So it's continuous work. And stigma and discrimination, stigma results in how policies are set, how institutions are arranged. It's stigma why you have residential schools. It's attitudes of one group or one subset of society being better than or different, needing to civilize or Christianize or changing another, that results in these kinds of things. Thanks, I'll stop there.
I want to thank everyone for their participation today. Unfortunately, we have run out of time, and there's been some really amazing questions in the chat that we weren't able to get to, but the chat will be saved. So thank you also to our Access folks who are here today. Thank you so much to Angie for their live captioning. Thank you to Mel and Sheila for their ASL interpretation. And thank you so much to Annicia for for coming and delivering such an excellent talk. And I also wanted to let people know that this has been recorded, and we will post it to the School of Disability Studies YouTube within the next few days. And for people who are here from DST 604, the recording will go up on your class shell. And Annicia or Jackie, do you have any closing statements you'd like to give before we sign off today?
Yes, I guess I could say before Jackie closes that it's been a pleasure speaking with you this afternoon. And I know that there are a lot of unanswered questions. I'm sure in Jackie's class, the conversation will continue. But absolutely, advocacy is the work of a lifetime. And really, I encourage you, I encourage myself, I encourage all of us to continue on this path of creating more equitable and more inclusive societies, working with persons with disabilities to achieve that goal. Thank you so much for having me this afternoon. It's been an absolute pleasure.
On behalf of the students in DST 604, I wish to thank you, Annicia, for designing the course. We are having fun. We are having lots of conversation. We are having some insightful arguments, as you can hear from the questions that have been coming up. We value this experience. We value your time. We value your experience. And so we don't take it lightly, because there are not many of you in the Global South who can deliver an address like this and respond to our questions. And I must just say, I must declare that I saw you as a student back in 2000 when I first met you through the very Barry Chavans, now deceased. And I thought that young woman has great potential. And I'm happy to say that we are sitting in this position where I am learning from you. And I, on behalf of the students that are in DST 604 now, on behalf of the work that they will do in the community, in Canada, in the various communities across Canada, and by what I've seen internationally, some are working internationally and have been working internationally, I thank you. I thank you, because the more we pull together, the more we talk, the more we converse, the more we have access to information and can share, I think it will be only better for disability activism internationally. And so I will stop there, because, you know, we can talk forever, and there's a finite time and there's a finite amount of money. So thank you. And I wish to thank Esther again for making all of this possible.